I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
We're talking today about inflammation. Every disease known to man has an inflammatory component. And inflammation either causes or drives every disease and makes it worse. So if we can just get the simple concept, no matter what condition you have, whether it's a sprained ankle or cancer, if we can get you on an anti-inflammatory diet, there will be benefits. It's not going to cure the disease necessarily, but it's going to help. And that's what it is when it comes to healthcare. There is no magic bullet. Every day, my listeners, like you guys, send me questions through the website, drjoe.com. What pill can I take for high blood pressure? What pill can I take for diabetes? What supplement do you recommend for erectile dysfunction? Whatever it is. There is no one answer to any health problem, but this is the general approach that you want to do. Change the diet. So an anti-inflammatory diet, good sleep, good exercise is going to provide a lot of benefits. It's going to improve arthritis, inflammatory bowel syndrome, lupus, autoimmune disease, decrease obesity, heart disease, diabetes, depression, cancer. Reduce those markers in your blood like C-reactive protein that are going to be telling us where the inflammatory reaction is in your body. It's going to better your blood sugar, your cholesterol, your triglyceride levels. It's going to improve your energy, your mood. It's going to improve your love life. You're going to sleep better. You're going to go to the bathroom better. You'll lose weight. No downside to going on an anti-inflammatory diet except one. And what is the one downside? The junk food sure does taste good. And every day, been doing this for a long time, every day people say, Dr. Joe, I can't do that. There's no way I'm going to give up my fill in the blank. Alcohol, meat, sugar, dairy, coffee, soda, breads, cookies, cakes, donuts, pastas, artificial sweeteners. And I say, listen, let's go slow. Let's go baby steps. Let's do this. Let's do this. Let's do this. Some people, like I said, jump in with both feet. I'm willing to do everything. And when they do, they're blown away in 2 or 3 days. They're like, oh my God, this is what I should feel like every day? Yes, this is what health feels like. Health is a good thing. I like health. If eating meatball sandwiches and provolone cheese was better for me than what I'm doing, believe me, I'd be doing it. I miss meatball sandwiches and provolone cheese. But knowing the reaction it has in my body, there's no sense in doing it. One of my patients and a friend has a gluten sensitivity. She had no idea she had a gluten sensitivity for a good portion of her life. And she said one day, she goes, I was going to one of these Mexican joints and eating wheat wraps and beans and cheese every day. She goes, I lost weight. She goes, I thought this is the greatest thing in the world. Why was she losing weight? It passed right through her. Once she cut out the gluten, she felt a lot better. Does she miss it? Of course she does. I don't do gluten. I hardly ever do gluten. I miss it, but it's not worth it. And so when you do these changes, you'll realize what I'm telling you really is exactly what you need, what you want to do. So chronic inflammation in your gut especially can disrupt the normal function of all your systems. 70 to 80% of your immune system is in your gut. And if you're causing an inflammatory reaction, not only is the inflammation feeding or driving other diseases, it's blowing out your immune system. And through the whole COVID-19 thing, we did so many shows on building up the immune system, getting healthy, fighting comorbidity. Comorbidity is other diseases that you might have that's going to make the new disease more, I hate to say effective, but more detrimental. So if you have heart disease, diabetes, cancer, overweight, those are the things that drove those COVID-19 patients, many of them, to die. Because almost everyone who died from COVID-19 had comorbidity. They had another condition going on. Was it 85 to 95%, depending on the study, had comorbidity. So if we could wipe out the comorbidity, we could have easily managed any crisis that comes into the world, and we'd be saving a ton of money on healthcare. Hospitals wouldn't be overworked, doctors wouldn't be overstressed, and we could actually treat the people that needed their treatment and didn't cause a lot of their own problems. And that's the sour pill to swallow. That I caused a lot of my own healthcare through diet. through environment, through using perfumes and hairsprays and air fresheners, and having pinched nerves and not getting them fixed, and having acid reflux and not coming to our offices so we can work on that. And so a lot of things that happen in healthcare you caused. Sorry to break the news to you. So recent research shows what happens is if you have inflammation, certain types of bacteria and body fat can increase the inflammatory reaction. So here we go to having good bacteria in your colon. Research suggests that when fat and bacteria come together in certain situations, they create something called a superantigen. These are toxic molecules produced by pathogenic bacteria, things like staph, and they may play a role in the development of things like even type 2 diabetes and how it affects your cells. So if you have a staph infection and you're obese or you're overweight and it interacts with the fat, we can create these super antigens. Antigens are the bad guys. The idea is that when fat cells interact with environmental agents, in this case bacterial toxins, they trigger a chronic inflammatory reaction, and the bacterial toxins stimulate fat cells to release molecules called cytokines that produce inflammation. So the bacteria interact with the fat cells produce cytokines. Some cytokines are good, they control inflammation, but an excess amount of cytokines is when the body starts attacking itself, which again, going back to COVID-19, is what a lot of people died of, the cytokine storm, producing too many cytokines, and the immune system went crazy. So if you have a staph infection and you're eating bad fats and you're fat, now we can produce these super antigens. How do we deal with this? Well, we may not be able to deal with the staph infection, but if your body's healthy, chances are you won't get the staph infection. If you control your weight, if you stay away from the bad fats, the omega-6 fatty acids, the vegetable oils, the corn oil, the soy oil, the canola oils, well, now we're doing everything we can to fight. Imagine disease is a battle, and you have warriors in your body, and the other warriors are coming in to attack you. Well, the more warriors and the better trained your warriors are, the better off you're going to be. If you've got these fat, sluggish, untrained warriors on your side, and the body's producing a bunch more of them, these cytokines, you're probably going to lose the battle. So these super antigens can cause some real serious problems. Another problem, the adenovirus. It causes respiratory infections and pink eye. They may play a role in promoting obesity by transforming adult stem cells into fat cells that are capable of making more fat. So we talk about stem cells, and in our office, we're going to be doing stem cells very soon. Stem cells are amazing. Stem cells are baby cells, and wherever they're needed, they go to that area and do their job. So if I need to regenerate my knee or my shoulder because I have arthritis or my spine, we can inject stem cells into that area and it can regenerate the joint. Amazing. We can also do something called PRP. And PRP is where we stimulate your body to produce its own stem cells. Works amazingly well. But if you have a respiratory infection or pink eye, this adenovirus in your body, it can then take these stem cells and cause them to create fat cells. So if you have this infection in your body, we have to be able to mitigate and control the infection so that these stem cells aren't stimulated to produce fat cells, which produce more cytokines, which then cause the whole reaction to kind of go awry. So stem cells are great when they're used properly. PRP is great when it's used properly, and you do that by adding all these other components to make it getting the best results. I've had people pay $5,000, $10,000 for stem cells and not get results. Not pay us, but pay other doctors. And I said, did the doctor ever talk about nutrition? No. Did they ever talk about anti-inflammatory diet? No. Did they ever talk about chiropractic, putting the bones back in place so the joints don't wear out? No. So this is why in our offices we cover it from all different angles. And this is the type of treatment I want. When I built my offices, the first Health Plus Wellness Center, it was built in Marietta. We opened in 1985. My goal was to set up a place where I would go if I needed treatment. And ever since then, 37 years, that has been our driving force at all my clinics. We have clinics in West Cobb, Marietta, Duluth, and Stockbridge. The driving force behind it is where would I go if I needed treatment? And all my doctors are handpicked by me, trained by me, and they're my personal doctors. So if I don't trust them taking care of me, I don't trust them taking care of you. And that's why we have this multidiscipline approach. And so again, If you have this one infection in your body, it can cause an inflammatory reaction, which can then spiral out of control. So obese people have a tendency to become heavily colonized with staph bacteria. So if you're overweight, bacteria in the staph can overgrow. Staph bacteria is also common and found in diabetic foot ulcers. So if you have diabetes, you may have an increased risk of staph infection, which can then cause more inflammatory reaction by interacting with the fat cells to create the cytokines and cause the inflammation. So this is another reason why we want to bring down the inflammation and get normal bacteria in your gut. And what are you doing to your gut? Every day, you're doing things that are screwing up your gut. You're doing things like antibiotics. If you need them, take them. I'm not saying don't take them. Chlorine in your water can cause an antibiotic reaction. Artificial sweeteners can affect the bacteria in your colon, sucralose especially. So your body's trying to build up these healthy bacteria and fight off things like staph infection, and you're doing everything possible, it seems like, to fight that. So if you have acid reflux, heartburn, burping, gas, bloating, diarrhea, constipation, you might want to come see us. And let's see if we can find out if there's a physical reason. Maybe it's pinched nerves, maybe the stomach is pushed up against the diaphragm, and we can pull or massage the stomach away from the diaphragm. We do it on about 85% of our patients. Let's look at your diet. Are you eating foods that are blowing out the bacteria? Even commercial meats and dairy products many times are loaded with antibiotics. And so now you're blowing out the bacteria in your colon, and the staph can then take over. If you're overweight, more likely to have staph infection in your body. E. coli. Now, yes, we can have E. coli in our body. We all do. But an overgrowth of E. coli can become really serious. So this can cause inflammatory reactions. So your gut is going to be a key player in inflammation. And you got to have the right bacteria in your colon. Dr. Joe's Super Greens and Dr. Joe's Essential Source are great sources of probiotics and prebiotics. Prebiotics feed the good bacteria. So again, we're going to help the warriors build up more warriors. Dr. Joe's Probiotics, we have one on the website, drjoe.com. It's a supplement. I take it every day. Now, unless you have small intestinal bacterial overgrowth, that's a whole nother story, you probably would do well by taking probiotics. And eating fruits and vegetables, which are prebiotics, which are going to be good for you. Researchers have found that oral health can have a significant impact in cardiovascular disease and heart health. There was a 2010 study that found that worse oral hygiene increased the risk of developing heart disease by a whopping 70% compared to people who brush their teeth as little as twice a day. Now, my father had heart disease. He had a rheumatic fever as a child, again, an infection, wasn't taken care of. The rheumatic fever attacked his mitral valves in his heart. And so my father, when I was in undergrad, had to have mitral valve replacement in his heart, very common surgery. And one of the things they did, every time he went for a checkup, he had to go to the dentist first to make sure his oral health was good so that the infection didn't spread to his heart. Because the same membrane that is your gums also covers your heart. And so an infection in your gums can easily travel along that membrane into your heart. And so you got to have good oral hygiene. I recommend electric toothbrush. My dentist recommended it years ago. I love it. Electric toothbrush at least twice a day. Flossing at least once a day. A water pick type thing that's going to get in between in the gums, and that works really well. If you have a mild infection, oil pulling. What oil pulling is, I haven't talked about this in a long time. Take coconut oil or sesame oil, about a teaspoon of it, and swish it in between your teeth and gums for up to 20 minutes. I can't do 20 minutes. I can do about 7 minutes and I start gagging on it. Spit it out. Don't spit it out in your sink because coconut oil will harden and clog up your pipes. Spit it out in the trash, spit it out outside. I have a deck on my backyard. I just spit it out into my backyard. And it's amazing. If I start having a toothache, the oil pulling works wonders. In most cases, it's part of a plan. It's not the plan. It's part of the plan. So oral hygiene is so important because it can actually cause an infection, which can get into the heart, which can thicken the artery lining, which can cause cholesterol to build up, which can increase your risk of heart disease. And so oral inflammation, we're talking about inflammation today, oral inflammation is going to be so important to maintain good health. And also it helps bad breath too. So environmental factors that can affect your gut flora, that can increase staph growth, which can interact with fat, which can cause more inflammation. E. coli, same thing. You want to make sure you're getting the good bacteria and reseeding the good bacteria in your colon on a regular basis because we're all stressed out, and stress can wipe out the bacteria. Antibiotics in our food. Glyphosate. Glyphosate is a weed killer. We used to use it on lawns. Now we're using it in commercial production of food. Glyphosate many times is sprayed on wheat. So if you eat wheat, which you shouldn't be because I'm not a fan of wheat, but if you're eating commercial wheat, what a lot of people are doing, a lot of farmers are doing, they're spraying the wheat with glyphosate to kill the wheat before it's harvested. What does that have to do with anything? It's a lot easier to harvest when it's dead. And so the glyphosate then remains on the wheat kernel, and you're eating it when you're eating wheat. So it's not just the gluten reaction that people are having with wheat. It's a glyphosate reaction some people are recently having now. So that, when it gets into the colon, can wipe out the good bacteria. So you're eating a piece of bread very innocently, not realizing it's affecting your colon. You're eating that with meat, maybe a turkey or a ham. Many times that has antibiotics in it. Then you put a piece of cheese on it, antibiotics in it. Then you're drinking tap water, chlorine, antibiotic. And so you're wiping out the good bacteria, which helps the immune system, which helps the inflammatory reaction. And the inflammatory reaction is related to just about every disease known to man. So we went down a rabbit hole. We're coming back out again. Okay? So reseeding your colon is really important. So Dr. Joe's Probiotic, Dr. Joe's Super Greens, an essential source. Fruits and vegetables help reseed and colonate the colon with good bacteria. Fermented vegetables are a great way to recolonate your colon. Now, sauerkraut, kimchi, I love them. But here's the problem. If you buy them commercially, what's happening is the commercial ones are pasteurized. And once you pasteurize it, you kill off the good bacteria. So you can make your own sauerkraut, you can make your own kimchi, your fermented vegetables. If you can do yogurts, same thing with yogurt, make your own. I recommend coconut yogurt or almond yogurt. I don't recommend dairy. Those are all great. Kefir, which is kind of like a liquidy yogurt, make your own. And this way the bacteria are there and good for you. So fermentation is really, really good in if it's the right type of fermentation. So ideally you want to avoid the antibiotics, antibiotic trace things, like we said, meats, factory farmed animals, agricultural chemicals, glyphosate's a biggie, chlorinated water, antibacterial soap. Antibacterial soap, not a good idea. Studies came out years ago. We talked about this years ago on the show, that it's killing off the good stuff as well as the bad stuff. So soap and water is actually more effective than antibacterial soap. And when COVID-19 came around, wash your hands 20 seconds, many, many times a day. I told people, please don't use antibacterial soap. And many antibacterial soaps or lotions have something in it called triclosan. Triclosan is an endocrine disrupting hormone. So plain old soap and water, folks. I use Castile soap. It's my favorite. It's a natural soap. I can't do deodorant soaps. I realized years ago when I was a teenager, deodorant soaps caused my face to swell up, like my eyes, my lips. So I'm not a fan of deodorant soaps either. And even something as simple as pollution can kill off the good bacteria in your colon. So diet accounts for about 80% of the health benefits you reap from your lifestyle. So diet is going to be the key here. Trans fats, sugars, all inflammatory. Avoid sugar. Avoid the oxidized cholesterol. Let me talk about this. I haven't discussed this yet. Cholesterol has gone rancid when it's overcooked, if it's been sitting around for too long. If something has cholesterol, it's an animal product. Plant products do not produce cholesterol. Somebody the other day sent me a question on the website, drjoe.com, and said, Dr. Joe, I don't want to eat too many avocados because of the cholesterol. If it's a plant, it does not have cholesterol. If it's an animal, it does have cholesterol. So if you cook let's say eggs, for example, you like scrambled eggs. When you scramble the egg, you're oxidizing the cholesterol in the egg, making it more toxic. So if you're going to eat eggs, things like sunny side up, where the yolk is still runny, is going to be a much better choice. Soft boiled, much better choice. But oxidized cholesterol, very dangerous. Whenever you cook anything at high temperatures, including barbecue or grilling, that's when you grill the things, and that's when the dangerous chemicals are formed. Nitrosamines. If you have a seasoned meat, like a sausage, okay? So these meats, when they're cured, that's the word I was looking for, cured. When you cure the meat, they add nitrates. And the nitrates, when it's heated among protein meat, creates nitrosamines. When you're grilling the meat, those grill marks are heterocyclic amines, known carcinogens. The smell of the grilled meat, which then drips around, the fat drips around and circles the meat. Those are polycyclic aromatic hydrocarbons. A lot of chemistry here, but all those things are carcinogenics.
What about grilled vegetables?
Grilled vegetables don't have the proteins or the nitrates, so they're fine.
But potatoes, you said, aren't good?
Potatoes are okay.
I thought you said earlier it made triclosamine or something like that. Something. You were saying when you fry potatoes.
Oh, when you fry the potatoes. Yes, that's a fried.
Because it's the oil that does
oil,
it. Oh,
right.
acrylamides, that's the word.
Right. Very good. I've got a bell. You got a bell today, right. The acrylamides happen. You take potatoes and fry them in a fat. Okay. But if you grill the potatoes, you're not going to have that much fat, so it's not that big a deal.
Okay.
So good question, though. That's brilliant the way you went around there. So these are the things, and the trans fats, of course, you got to avoid. What else can we do to decrease our inflammation? You got to optimize your vitamin D levels. Vitamin D is another important aspect of optimizing your gut health and the bacteria in your colon. According to research, vitamin D appears to be nearly as effective as omega-3 fatty acids in counteracting inflammatory bowel disease like Crohn's and ulcerative colitis. Every day, patients come in with Crohn's and ulcerative colitis, and you got to get the vitamin D levels up, and you got to get the omega-3 fatty acid levels up. On the website, drjoe.com, we have an omega-3, and we have a vitamin D. Vitamin D is the cheapest insurance policy you'll ever buy. It's got to be vitamin D3, not vitamin D2. On the website, drjoe.com, vitamin D, you want to take about 5 drops a day. That's 5,000 international units. Now, if you're out in the sun a lot in spring, summer, and early fall, you probably don't need to take the vitamin D. But we do a test in our office. It's a micronutrient test. With that, we can test thyroid function, we can test oxidation, we can test immune function, we can test micronutrients, we can test vitamin D. I strongly advise, if you want a general blood test of health, not just your basic stuff, your blah, 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 your blood count and everything, but actually the function of your body and its health function, we can do the test, the micronutrient test. It's on the website, drjoe.com. And you can send us an email if you want more information. But go under clinics and then services, and it has the micronutrient test. But we should test our vitamin D levels. I get mine tested regularly. But it can help so much with digestion because it helps with the inflammation. The omega-3 fatty acids, I take them every day as well. They're vegan omega-3s because it helps with inflammation, it helps with brain function. They're essential fatty acids. Essential means you have to get it from another source outside the body. But if you're vitamin D deficient, your immune system is not going to be active and it's not going to do its job. And since vitamin D modulates your immune system, it controls your immune system, it helps prevent overreaction from inflammation. So supplement-wise, Super Green's essential source omega-3s and vitamin D whenever there's an inflammatory reaction. And that's why when patients ask me, Dr. Joe, I want a general supplement protocol. Super Green essential source omega-3s, vitamin D, digestive enzymes, B-complex. That's the general basic protocol that almost everybody's going to benefit from. All those are on the website, drjoe.com. Now, if you come by our offices in Marietta, Duluth, Stockbridge, and West Cobb, you can save the shipping costs. I don't want to pay the post office. I'd much rather put the money in your pocket. So you can come by the offices and pick up the supplements you want. And if you want to become a patient, of course, we'd love to have you as a patient. We used to charge $375 for the first visit, which is the exam, x-rays, consultation, first treatment, going over the x-rays on the next visit, going over your nutrition on your next visit. All of that was $375, which was still discounted. It's usually about an $800 service. We've brought that down to $149. And we're doing that short term to help folks out, get over this COVID issue, get over their financial crises that we've been through. So if you want to make an appointment, now's the time. We can't run this special forever, folks. So if you go to the website, you can make an appointment right there or call the offices and we can go ahead and book that for you. We accept most major medical insurances, car accidents. If you've ever been in a car accident, ever, if the car was damaged, you were damaged 100% of the time. That's for you, your friends, your family, anyone you know. If there's a car accident, get them to us right away. Number one, they need the treatment. Number two, I don't want to get them scooped up by some of these scam clinics up there. There's a lot of scam clinics and scam lawyers that are just trying to run up the bills, close the case, and get rid of you. I see cases like that every day. Dr. Joe, I went to blank clinic. There's several of them. I won't say their names. And they threw some hot packs on me. The bill was $5,000, $10,000. They closed the case. I got almost nothing, and I'm still having all the problems. Please don't get involved with that. Come see us and make sure you're getting the right care that you need. So if you want to make an appointment, drjoe.com, do it soon, and all the supplements are online, or we can ship them to you. Running out of time. If you're ready to get well, go to our website, drjoe.com, make an appointment to come see us. If you have any questions, send them to us through the website, drjoe.com. The supplements are on the website. Over 1,000 hours of podcasts are on the website. It's a great website to run down the rabbit hole and get lost. So if you have any issues, let us know what they are. We want to help get you well and keep you well. Tell your friends about the show. Follow us on Facebook and Instagram at Dr. Joe Esposito. Folks, I'm Dr. Joe Esposito, drjoe.com. We'll catch you next time.
Thanks for listening to For the Health of It. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on the WSB Radio app.